The recorded topic today is writing individual health plans to support students with IEPs or 504 plans. I am your host, Mary Ann Strawhacker. I am a special education nurse consultant at Heartland Area Education Agency. Starting out, I like to show you where on the framework this particular skill set fits. And if you look at care coordination, student care plans are listed in the framework. As you know, in Central Iowa, we call them individual health plans. Other parts of the state have other acronyms that they use instead of IHP. It's also important to look at the standards of practice. These apply when we're looking at the position statement that relates to individual health plans. Also, our scope and standards of practice apply to the nursing process and writing individual health plans. This particular version of the scope and standards of practice is very new. It was just put out last spring, and it covers all of the areas that are critical for a school nurse to learn and be able to demonstrate competency. The first section of the book talks about the various steps of the nursing process and breaks those down. This particular reference is really helpful if you are feeling like perhaps you've been out of school for a while and perhaps some of the steps have changed a little bit. Very important to go back to this resource. All of these are found through NASN. The position statement for IHPs was actually redone in 2020. The important parts I have highlighted in different colors to help us break it down a little bit. Oftentimes, the questions that we get are difficult to answer because of the way they're asked. What I like about this particular position statement is it really does give a lot of good information about IHPs. We write IHPs for students that have health conditions that could have a negative effect on their attendance or academic performance. Oftentimes, they have chronic health issues, or they may have had an accident or injury that's going to have ramifications for a number of months. That could also be a reason to write an IHP. Fortunately, not all IHPs have to be written at once. It's important to stagger them out. I tell nurses to write the IHP so that it correlates with the student's IEP or 504 annual review. That way you don't have everything due the first day of school because that's challenging. And then the first few weeks of school, you're going to focus on those students that perhaps moved into the district or students who had significant health issues over the summer. Prioritize those students that have significant services during the school day, something that occurs perhaps every single day. You need to perform a nursing task for them, give a medication. Second of all, we prioritize those that have the potential for a medical emergency. Maybe it's not everyday care, but if they have a seizure or they have a low blood sugar or they have a reaction to an allergic reaction to some type of a contact, it's important to have those emergency plans done. And I would actually say they're very high priority, making sure that at least that piece is done. And then you can always go back and add an individual health plan to your intervention. So you can start with that intervention just because it's critical for safety. And then finally, those students that have a 504 or have an individual education plan that's been written for them, program is the official word, but we oftentimes say plan. It's important to note that not all students that have a 504 or an IEP need an individual health plan. Sometimes we get into diagnoses that are maybe vision related or hearing related, and there may be very little that we can do as a nurse to help their access during the school day. If that is the case, we wouldn't write an IHP for that. Oftentimes on the listserv, I see nurses asking for IHPs for really uncommon medical conditions. What we're looking at for nursing diagnosis is that student's response to that particular diagnosis. How does it affect them? Are they at risk for highs and lows in blood sugar? Are they at risk for depression? Are they at risk for anxiety? Those types of responses are what we address as school nurses, not medical diagnoses. Of course, there are legal considerations. The first big consideration is looking at our state law. As a licensed registered nurse in the state of Iowa, we have to abide by Chapter 6 of our Nurse Practice Act. That should be familiar to everybody, even if you've practiced in a hospital setting and maybe haven't had to be as concerned about law simply because you had policy and procedure manuals. They incorporate Iowa law within those manuals, so you don't have that direct need to read Iowa code. The other things we look at are the rules of special education and education law relating to nursing practice. The latter of those is written to govern all health services that are delivered during the school day. In school nursing, we're also subject to federal law. Since education is highly funded by federal money in addition to state money, we have to follow what's written in IDEA, which is special ed law, Americans with Disability Act, and Section 504 of the Rehabilitation Act. All of these laws come into play when we are creating and implementing an individual health plan. I like to go over what the Board of Nursing expects, and I like to do this first. This code chapter was rewritten in 2021. What's important for you to know about that is that some pretty large changes happened. A lot of it was in how we talk about terms and also an update in terms. The nursing process has remained the same now for a while. There have been many additions. When I started, there were 4 steps to the nursing process. Now there are 6. NASN breaks out 5 into 2 parts as well, A and B. If you look at the pieces that are in code, it mirrors the nursing process. We're responsible for that nursing assessment. We're responsible for applying the knowledge that we have. We're responsible for figuring out what's missing. Do you need a particular record from a physician? Do you need orders? Do you need so many things that we may or may not have access to during the school day? We need to acquire. And that can be done through a release of information, or a parent, if they have a copy of those records, can share those with you. To perform some of the tasks that we do during the school day, we also need medical orders. There again, it could be the parent requesting those orders, could be you with a release of information, but we do need orders. And then determining, once we get all that assessment information, what is it that applies for a nursing diagnosis for this particular student, or what is the student's response to all of the conditions that they've been diagnosed with and are currently managing with their healthcare provider. Planning nursing care is looking at how we as a school nurse are going to deliver interventions to bring that student to a higher level of health status, or prevent things that we can prevent from occurring, such as emergencies. This is probably one of the biggest changes. Our former Nurse Practice Act was written for goals, and the current one talks about achievable outcomes, expected outcomes. You'll hear some different terms, but outcome is what we're now using to measure the effectiveness of our nursing interventions. I put the last 2 on here just as a reminder that if there is something unfamiliar, if you haven't done a tube feeding or haven't suctioned a trach in a while, make sure you get that education. And there are multiple ways to do that online. Give your nurse consultant a call. There's also information that we can access through our professional organization, the National Association of School Nurses. And the final part, it's important that we implement the IHP. As soon as it is written, as soon as that child has been staffed, either with a 504 plan or with an IEP, and there is need to accommodate based on disability, that's where we're going to start that process of identifying and implementing. Iowa Code 28114 relates to school health services in general. These are the two parts that apply to the IHP. The first one is that when we are using our ongoing professional judgment, we need an individual health plan written. That is to mirror the care that we're giving and to show that we have gone through the steps of the nursing process in order to arrive at those interventions. The other part of this is that prior to providing services, we are to create that individual health plan as a document that shows others what it is that nursing is providing for that student. Parents, other members of the IEP team or 504 team, and especially, I think, administrators. Individual health plans are also extremely helpful for substitute nurses to know what needs to be done and how it needs to be done. Moving one step further along, what is the purpose? We've talked about some of these. What is also important is that it supports a free and appropriate public education for a student. We don't charge for nursing services. Now, Medicaid does allow billing for nursing services and for personal health services. That fee is not charged to the family. That's why it's free and appropriate public education, but it is charged to Medicaid. We are preparing for anything that might be an emergency at school, and it details those services that are allocated, which is a resource. School nursing time is a resource that is allocated to students who have the need for that. When students receive those services, that supports student success and achievement. I'd like you to take a minute. Anytime you see these little light bulbs with the flame coming out, that's where I want you to pause this recording and take a minute and go through the activities. I would like you to practice as we go through this, just so that content sinks in. Sometimes it's easy just to listen and then feel like at the end you really didn't learn much. So I want you to practice this as a way to retain the information and be able to use it. Standardized nursing language has been around for a long time. It's used less now than it was even 10 years ago. It is perfectly acceptable, in fact, some would argue best practice, to use standardized nursing language. If you never learned it as part of your education in nursing, the most important component, I believe, is the NANDA, Nursing Diagnostic Labels. We talk about nursing diagnosis in Iowa Code. It is certainly an expectation that you will use it. As far as using NIC, Nursing Intervention Classification, and Nursing Outcome Classification, that's a little less important. I just wanted to introduce you to this because, especially NIC, I go through there for ideas related to interventions. I find some great things in there, good suggestions, even if you don't write it out with their particular numerical system. This is another book that can be helpful. This is through Sunrise River Press. I do have permission to use this particular slide, and I'm not selling the book. I do not get a commission from this. What is important to note is that every one of those interventions begins with a school nurse. That can be a little tedious. You can edit these, and that was the other point I wanted to show, is that all of this is edited. Interventions are not numbered in the system, but I added numbers. If we're looking at the nursing diagnosis, that oftentimes will be a multiple choice. You can choose which diagnosis, and expected outcomes are also a choice. Expected outcomes should be measurable. The ones in this program are not as measurable. It does require some finesse on your part to make it meet standards. Let's get into the parts of the nursing process that are applicable to writing an individual health plan. First of all, your nursing assessment is what everything is based on. You need to take the time to really get to know the student and their information. That can mean getting a release of information to get orders, could have the parent deliver orders. Some of our really involved students, home visit is very, very helpful just to see how that parent provides care so that you can duplicate that at school and make the student feel safe. RIOT is this process we go through to gather information for an IEP. Review of records. You can review records on any student. That's information that's in your office and is readily available. The second part of it is interview. Lots of good information comes from interviewing parents, the student, teachers, anybody who might have knowledge or access to information. Perfectly acceptable to interview them. O is observation. Whenever that child comes into your office, you're observing, you're gathering good information. T is testing. Maybe you're taking a blood pressure, a temperature, blood sugar, lots of different measures that are objective can be entered in and can be very good information to use when constructing an individual health plan. Once you collect that assessment information, you're going to narrow it down and determine what is educationally relevant. There are a lot of good things we can do for kids, but if we're talking about trying to improve their diet and they only eat a lunch taken from home, a sack lunch, we're not going to have an impact. I'm just going to be honest, we're not. If, on the other hand, you've got a student that maybe eats 2 meals a day at school, you might make a little bit of headway. The question becomes, if they don't suffer from food scarcity, again, is that something that we're going to focus on? If, on the other hand, we've got a student who is diagnosed with diabetes, carb counts, making healthier selections, all of that is highly relevant and should be something that we address with the student if they haven't already mastered those skill sets. When we're looking at a diagnosis, some kids, you will have 6 or 7 nursing diagnoses that would fit. It's up to you to decide what is the best fit, and is there one increased readiness for health maintenance, increased readiness for health management. Some of those bigger categories are easier than looking at, say, an individual diagnosis that has little implications. The other thing is that we're trying not to overlap on others' practice. One of the diagnoses that was discontinued in NANDA had to deal with sensory deficits, such as vision or hearing. We as school nurses aren't going to impact vision and hearing. That is something that I would tell you not to include on there. Now, if it has implications for safety, that's something different. And we would address some safety type things like risk for injury, risk for falls, but we're not going to address visual impairment. Also, we're going to make sure that when we do pull out a label, we're going to emphasize our energy, our interventions on building skills within that student, making them more independent for self-care, preventing things that could go wrong, and managing those risk factors that we know are going to lead to a poor outcome. Sometimes parents have real preferences. And I say that having dealt with parents who don't want their children to become more independent. And that is hard for us as nurses. We want to teach, we want to mentor, we want to coach. We are right in there wanting those children to have appropriate, age-appropriate skills to manage their chronic health conditions. If that isn't where the parent wants you to go, we don't go there. For this particular activity, what I want you to do is pause the session. You're going to read this little short scenario, and then I want you to pick from that list the top 2 nursing diagnostic labels that you're going to choose for John. Everyone asks me at this point, what are the correct ones? It really comes down to what you want to focus your individual health plan around, what you're capable of doing. And by that, I mean some buildings are just overloaded. You may not have time to focus on some smaller issues. So you could pick the health maintenance diagnosis and make that a big umbrella that you put everything under. Or if you want to address his drinking and trying to get him to drink more fluids through the day, that could be appropriate. You can make a case for any one of those diagnoses. It just depends upon how you plan to develop your plan of care. The parts of a nursing diagnosis, I teach a 2-part diagnosis. It is perfectly acceptable. In fact, many would argue best practice to have a 3-part nursing diagnosis. You start with a diagnostic label related to whatever the factors are. Risk for injury related to uncontrolled movements of seizures is one. And then finally, that 3rd part is actually defining characteristics. It's like the justification for why you chose a particular nursing diagnosis. I put some examples on this slide just for you to take a few minutes and to read through. The first 3 are risks for. Anytime it's a risk for a particular condition, those are 2-part statements because it hasn't happened yet. The last 2 are actual statements. Therefore, you could have those defining characteristics. Common diagnosis errors. When you're looking at these, I did an activity when I used to do live sessions for the individual health plan, and I would have nurses look at real health plans and figure out some of these errors. I'm going to tell you about them, and I'm sure that if you get any type of individual health plan from another nurse, you might see some of these, so I wanted you aware. First of all, it's like throw everything in a bag and certainly it'll sort out, right? One of the more common mistakes I see is nurses will select all the nursing diagnoses that apply, all the interventions that could apply, and then create goals or outcomes that don't link to any one diagnosis. It's not an individual healthcare plan. An individual health plan links each part together so that there's a straight line across. This is what the diagnosis is. These are the interventions that are going to make a difference. And when it makes a difference, this is what you will see, and that's what the expected outcome is. Listing a simple problem, concerns related to and not using NANDA. This becomes an issue should you ever be called into court for litigation or in a due process hearing for special education. The standard really is to use NANDA. I strongly encourage nurses to do this. However, you cannot use a label by itself. Pain. Okay, pain. Related to what? What is the reason that it's relevant and how is it manifesting? In that particular instance, I'd like to see the 3rd part. Is this a kid who shuts down? Are they crying? Are they asking to come to the nurse? How is it manifesting that you know that this is a concern? I talked a little bit about choosing those diagnoses that are literally challenging, such as anything having to do with communication. The mobility pieces are going to be covered by PTs, and some of the fine motor is going to be covered by OTs. The delayed development nursing diagnosis is one that I do not encourage nurses to use simply because we're not going to do anything that is going to fix developmental delay. That's the teacher education piece of it. Therefore, I wouldn't advise using it. And then the other part, when you use the second part of the nursing diagnosis and say related to ADHD, let's look at impulsivity related to ADHD. That doesn't tell you much. If we look at impulsivity related to inability to suppress, inability to regulate behavior as manifest by frequent disruptions, inability to stand in line in the health office, and you're going to have a whole list of things. That might be something that you could tackle, that impulsivity. There again, if you aren't with the student very often, I would look at some other things to tackle for a student with ADHD that you give medication to. You could look at many different areas as a result. If you are totally stuck, you would say ADHD secondary to ADHD as opposed to related to. Related to are those functional kinds of descriptors that cue everyone in as to why you selected that particular label. The list of requirements associated with outcomes are very easy to remember, I think. It should always be centered on the student. Although we certainly want staff to learn how to use an emergency action plan, how to perform a particular task, the individual health plan isn't about the paraprofessional or about the teacher. It's about the student. If we're looking at an outcome for a student that maybe is very low functioning, John will receive emergency interventions within the first minute his seizure occurs. That requires a lot of staff training, but it is student-centered. They have to be measurable. If he doesn't get his service within a minute, did you fail? No, but you may need to go back and revise some parts of it. Was it failure to recognize the seizure? Some seizures are really challenging to identify. Was it fear factor? Were they hunting for the emergency plan? What delayed that student receiving that care? And then looking at remedying that. They have to be attainable. You have to be realistic. We're not going to jump 4 or 5 steps with a student in 1 year. If we're starting out with maybe they're learning how to better apply that ostomy bag to avoid leaks. Maybe they're uncomfortable emptying the ostomy bag. What are some things that we can tackle in a year with the limited time that you have without pulling them from class? And then we base on those needs at school. If we can make that student more independent with management of their condition, much improved outcomes for that student. This actually relates to SMART goals. I still teach it simply because it helps you look at whether or not you have all the pieces needed to have an outcome that is measurable and specific. If you read through this, apply it to any goal that you've written and see if you have all the pieces. I do challenge you to do that for at least the first few individual health plans you write for class. I think it's really important to go back. I can't tell you how many times I send out this SMART handout to school nurses that are just starting out. Very important to write better outcome statements. These are 2 examples. You'll notice the specificity. You'll notice the fact they're measurable. You'll notice the fact that they are very individualized. That is what we're going for. Nothing nebulous like Jeannie will increase her knowledge of diabetes management. Well, how are you going to measure that? And what part? What part is most important? Is it that she's struggling to manage her insulin pen? Is it that her glucometer is never maintained? What is it that is really challenging about that particular student that if it was fixed or improved, everything would change? I'm going to ask you to pause again to write an expected outcome for one of John's nursing diagnoses. Use that SMART format and see how well you've mastered the content. Nursing interventions are probably the most comfortable part of writing an individual health plan. As nurses, we immediately jump to what do I do for this student? Very simple jump. I would strongly encourage you to not jump. It's important to look at problem analysis. What is it you're seeing as a concern? What is the nursing diagnosis? And how does that manifest in that student? What is it that you can do to make a difference for them in school and in their planning for dealing with their chronic illness? If you remember back to the Sunrise River Press book and their program, you'll notice that every single one of those interventions started with the school nurse will. You do not have to use the school nurse will, but every one of those actions are what are performed by the nurse. If you're writing in the associate will, that's incorrect. Now, if you're writing in that the school nurse will train the associate to recognize the signs and symptoms of respiratory distress, such as, and then you list them out, or to perform a particular procedure per protocol. It's what you are doing, and then supervision. How often are you going to supervise that task once you've taught it? Make sure all those details in there. Also, what are you delegating and why are you delegating? Referrals, collaboration, all of those things need to be included. There's so much that you do as a school nurse that's automatic. You do it without ever thinking, but it is part of what makes a huge difference for students. Do your best to give yourself credit and capture those things within that individual health plan. Here's another example for that ineffective health maintenance. And if you notice, each one of those interventions begins with a verb. That's a shorthand way of writing those interventions. I like to do it that way because the school nurse will gets redundant and the verbs really focus on what you're doing. Dependent nursing interventions, in other words, things that are ordered by a healthcare professional that has the ability to prescribe, need to have some documentation associated, such as the written order. Also, by code, that 28114, we must make sure that we have parent permission to perform special health services at school. That rationale for delegation needs to be associated, and procedures or protocol sheets for whatever it is the task that we're going to teach. And we need to keep track of what we've done and when we did it. When did you teach that para how to perform the task? Did they demonstrate competency? That's where those training checklists come in and other types of documentation. I put this slide in here just to get you thinking about all the things that can and should be in the file to support what it is that you've done. Try to write 3 interventions and then start up the video once again. Emergency plans, as we talked about earlier, are where I would start with students that have an event that could turn into emergency and need special handling. But an emergency plan, a seizure action plan, a low blood sugar plan, none of those plans take the place of an individual health plan. They can be separate documents, but list out the emergency health plan or emergency intervention plan or action plan as an intervention in your individual health plan. What I think is important to note is that not all students will have an emergency plan. They don't need one. If there's not a potential for emergency, and if there's not something that you can do prior to 911 arriving that will make a difference in that student outcome. Oftentimes you'll hear school nurses talking about, well, I've got a seizure action plan. Why do I need an IHP? If you think about an action plan, it's everything that you're going to do in that particular emergency as ordered by the physician. Within the school, as you implement that, you need your own steps. How are you going to train staff to respond? What is it that you're going to do to reinforce what the student needs to do to assist as well? Who's going to carry that EpiPen on the field trip? Who is going to make sure that you've got rectal diastat available both at school and on the bus if you need it? Lots and lots of details associated to support that seizure action plan written by the physician, the neurologist. That's where all of this comes into play and why you need both. Remember, too, that you can write the emergency plan directly in the individual health plan. You don't have to have two separate plans. I think it's easier to have a separate emergency plan because that's what you want the teacher and that paraprofessional, if the student has one, to have access to and to be easily able to implement. Emergency evacuation plans come into play for our students that need some assistance getting out of the building in an actual emergency or engaging in building evacuations along with their peers. We consider those for students that have physical or cognitive disabilities that would make it difficult for them to follow routine process and procedures. And if they need an alternate emergency evacuation plan, we have to write one according to the rules of special education. Who writes them can be a little more confusing. If it's a student that really doesn't have health needs but more cognitive impairment, teachers oftentimes will write those because it involves the paraprofessional that they direct. If it is a student that has anything medical, if they evacuate the building, they need a snack with them for low blood sugar, or they need their EpiPen in case they get stung by a bee when they're outside in the spring. Those types of planning, what happens when you exit the building and you can't go back into your office? How are all those supplies going to meet up with that student and their para or with that classroom teacher and the student so that you can maintain care for them whether you're in the building or not? Think about all those things and write that again. It's an intervention as part of your IHP. 281.14 says that we need to revise individual health plans at least annually. Most individual health plans can go for a full year. If you have a student whose health status changes, they have a surgery or they have an event that changes, you do need to update whenever that happens. For the paper copies, you can make changes right on the document and do like we do for a record, in that you're going to initial it and date it when that change was made. If it's electronic, you are going to update as needed, but you're going to print a copy before you update. So you'll have a copy of what it was, it should be dated, and then your update should also be dated so we know when the changes were made. Sometimes you just need to start over too, and that's all right, but save a copy of what you had before. When we talk about IHP interactions, I think it's important to note that in school setting, individual health plans have a pretty large role. If the district, your district, is billing for Medicaid, the individual health plan serves as a treatment plan to allow the district to bill for not only personal health services, but also nursing services. I would advise you in the next time you have the opportunity to check out what it is your district is billing for and which students are listed, allocated health services in addition to nursing services. With a 504 plan, the individual health plan and the 504 plan work together. A student does need both because the 504 plan simply lists accommodations and services. It doesn't go into detail. Your individual health plan is what details out those services. And then finally, with an IEP, in Achieve, there's now a place to upload an individual health plan. As in the past, it is possible to list in the service description the location of the individual health plan and then not upload it. That is my personal preference simply because you can and should be using those IHPs, adapting them as needed, and not worried about having to redistribute a new copy to everyone. just because you made some changes. Here's my contact information if you have any questions. Also, as a disclaimer, since I mentioned many NASN resources, I am highly involved with NASN, and they have a lot of good materials. They are the only professional organization out there for school nurses, and that's why I use their information. I hope this session was helpful. Please contact me if you have any questions.